Hi folks, I'm Chad Newton and today I'm going to be teaching you how to measure the human heart rate. I'm going to teach you how to use a watch with a second hand on it, like this one. And I'm going to tell you how to use your stethoscope in that process. And I'm also going to be teaching you the different places that you can measure the human heart rate, the human pulse on different parts of the body. And I'll teach you the different situations where you're going to be able to apply that. So first of all, the human heart rate is between 60 to 100 beats per minute. That's the normal human heart rate. So if somebody is feeling for a pulse, they should be anywhere between 60 to 100 beats per minute. If the person is less than 60 beats per minute, we would describe that as bradycardia. Brady means slow. And if somebody is higher than a heart rate of 100 beats per minute, then that person would be tachycardic. There are different types of tachycardia, but we will not get into that right now because we're just doing a basic nursing course. So you should have read up from the chapter that I had assigned you to become familiar with the different places that you would do a pulse. So I'm going to show you in a video demonstration now how to do that. All right, so starting from head to toe, that's what we do in nursing. You can feel for a pulse just by the ear. This is called the temporal pulse. So you put your finger right by the ear here, between where my hair is and my ear, and you can feel the pulse right there, and you can do it on both sides. So that's the temporal pulse, okay? As we go down, you have the carotid artery, which runs right here. So between your trachea and one of the ligaments here, you should be able to feel the carotid pulse. You can use two fingers, all right, and you just feel. Try it. Okay. And you can do that on the other side as well. Now you don't do the carotid pulse with both sides at the same time because you could occlude the blood flow to the brain and the patient could pass out. So if you're doing a carotid pulse, you really want to do it on just one side, okay? Also, typically as a nurse, you would not be feeling for the carotid pulse unless the patient is in a rapid response. Same thing for the pulse that we're going to talk about a little lower. So obviously the heart, which is on my left side, this is sort of skewed to the left, you can listen for the apical pulse using your stethoscope. So your apical pulse is right below the nipple. So you put your stethoscope right below the nipple here, and the apical pulse, you would listen for a full minute. That's how we teach in nursing school. So you put your stethoscope right under the nipple, and it's really, you measure it from it would go 5th intercostal space below the clavicle. So you count your ribs if you want, 1, 2, 3, 4, 5. And this is where you would put your stethoscope to hear the apical pulse. Then on your arms, you have the radial pulse. So you would hold your radial artery, which is right here next to the radial bone. Then you have the ulnar pulse, which is next to the ulna bone on your arm, right? And then you go up to the brachial artery. Brachial artery is right there in your elbow area. Sort of into the interior part of the arm. And of course you can do it over on the other arm. You have your radial pulse, your ulnar pulse, and then you have your brachial pulse, right? Then you go down a little further. So on the human body, we have the femoral arteries that go down your right thigh and your left thigh. So the femoral pulse is right there in the groin. I'm not going to show you for decency purposes on this video, but typically you wouldn't even do a femoral pulse on a patient again unless they're in a rapid response. So if you have 10 people in the room and you can't get a pulse, you would do the pulse right up here, the carotid, or you would do the femoral pulse because those are major arteries and you should be able to get a pulse there. If you can't, the person needs some serious medications. And then I'll back away a little bit to tell you that you can also feel the person's pulse on the feet. So on the top of the feet, now I'm not wearing socks because I want to show you, this is where you would feel the dorsalis pedis pulse. It's called the dorsalis pedis. And you just feel for the pulse on the top of the foot. And then at the back posterior tibial. So you feel back here. Let's try it at home. Put your fingers right here at the back of the ankle bone, and you should feel the posterior tibial. And again, this one here on top of the foot is called the dorsalis pedis. All right? Now, let's just do how to measure the pulse real quick, and then I will end the video. So you have your second hand on your watch, right? Usually you wait for it to get to 0, and you get your fingers ready. So you're looking at the patient, you have your fingers on the radial artery, and then when your second hand gets to 0, you start to count. So I'm gonna see if I can show you like so. Can't really see the second hand on my watch, can you? Oh, maybe you can. All right, so it's gonna get to 15 right there. You start counting the pulses as the clock ticks, and you feel the person's pulse. And as it's counting and ticking, you wait for a whole 30 seconds or so. You're counting, and then when it gets to 30 seconds, you stop counting, and you can multiply that by 2 to be able to see what the heart rate is over 1 minute. Or you can count the pulse for an entire minute, and then that way you can see how many beats the person has in 1 minute, okay? So I hope this helped you understand a couple of things, how to do a heart rate on a person, what the normal heart rate is on a human being, the different places that you can measure the heart rate or the pulse on the human body, and the different situations in which you would employ that, whether it's a normal patient assessment or during a rapid response. So thank you so much for watching, and I'll see you in lab, where we'll practice this in person.